So briefly want to introduce our CPDA team. Our assistant director is Sherry Fisher, and she is on the call with us as well. Our senior manager is Jane Basowitz. Myself, I'm Jada Higgs. I'm one of the program administrators for CPDA, as well as Tony Avery, who also works with CPDA and MyCME. And we have Marilyn Render, our senior program administrator for CPDA. So we're happy to have you join us this afternoon. We hope you find our webinar informative and make good use of time here. So let's go through the learning objectives for today. Today, we're going to describe the components of the CME application, process, and timeline. We're going to identify a few resources to assist with the development and submission of a complete and compliant CME application. And we're going to discuss the new language on the program requirements document for the ACS MyCME and the AutoSend feature. So with that, I'm going to turn it over to Marilyn, who's going to cover the ACCME accreditation.
Thank you, Jada. Good afternoon, everyone, and thank you for joining us today. For the ACCME accreditation overview, one would ask, why is it important? The College of Surgeons is an accredited provider with accommodation, and this accommodation is through the ACCME, so it is important that we maintain that accreditation. We will be up for reaccreditation this year, so it is our duty to comply with the standards of the ACCME accreditation criteria that is set. The ultimate goal is this accommodation improves patient care, and it plays an invaluable role to help our physicians and healthcare professionals improve patient care. Some of the additional accredited benefits as shown here is, I'll just highlight a few of them. The improvement of patient safety, it controls spending so there isn't waste when you're spending those dollars and adhering to the budgets that are set for the organizations that are presenting. It expands preventive care and also improves performance in individual learners and organization. Again, these are some key factors to consider when you are seeking accredited CME from the College of Surgeons. So now I'm going to go over the CME accreditation platform. Many of you have put in an application with us, and we appreciate your business, and we just want to remind you that anything and everything you need is located on the website for the CME accreditation platform. So again, we are here to assist you, but this is just a reminder that everything you need to put in the application and tools and services, videos, etc., are located on this platform. One of the items that we would like to identify today is we get a few questions of people wanting to find out more about the disclosure list, the disclosure summary, and forms. And please note that the disclosure list provides a template on how all of the disclosed information is displayed to the learners. This is something that's generally part of your program materials. You list what those the speakers or anyone that's involved in the session. It is usually an insert. Some individuals have put that on a slide. Some have had it on a table. But whatever the case is it is a list of what has been disclosed. If there is a conflict and it's been mitigated, this is the list that is used. Now, also, that is required of us is the disclosure summary. And as stated, it just surmises the responses that the individuals who are a part of the activity have submitted to our team or your administrator to review and approve. In the past, the disclosure form, the ACS has a standard form that is used for each individual who participates or presents at during your activities. In the past, we've ask for those forms. We no longer require the actual disclosure forms. The only thing that is needed at our level is the disclosure summary and the disclosure list. So please keep in mind that these are required materials that need to be reviewed and approved by our team administrators. And if you have any questions during the live Q&A, we'll be happy to address some of your questions if you have some. And again, those forms and templates are available on the platform as well. Another, not really a change, but an update. In the past, we talk about planning minutes or a narrative. Please note that all we will need is a recusal statement. And this is a one-page document that has the title of your meeting, the date of that first planning meeting to discuss your program, and who was in attendance during the meeting, and of course, who was absent, who would have been a vital part of the meeting. The key factors are the statement at the beginning of this planning process. We would need to have on that sheet a recusal statement as noted here. All individuals with a commercial interest must recuse themselves from any portion of the planning process as it relates to their commercial relationships. Very important. It is also noted that during the meeting, a statement of recusal of any member who has indicated they have a potential conflict of interest on their form. You should include their name and that who that member is, and to make sure that member has recused themselves when any discussion where they stated they have a conflict would influence your program. So please keep that in mind when you're planning your sessions. Another item that was brought to our attention is commercial support and commercial guidelines, only if this is applicable, of course. And as a reminder, we are here to assist you with these tasks, but your commercial support usually always requires a letter of agreement. And this letter of agreement must be signed by your parties as well as the ACS. So we ask that you allow time for us to review the contents so that we can get that information back to you. It is important that all parties, when you're having support, what type of money or type of report we have on our website, a vast amount of information to assist you in what is designated as commercial support, and how to identify what areas can be captured as having commercial support for your programs. Another item is the commercial promotion guidelines, and these are any marketing efforts that you are putting out as it relates to your ACCME identified programs, in case ineligible companies that want to promote products. Again, all of this information is clearly identified on our website. And during the Q&A, if you have any questions, please let us know at that time. Next, I'd like to go over the ACCME rules. There is something that we would like to bring to your attention when it comes to the changes in the learners, the competence, performance, and patient outcome, as it's achieved as a result of the program's overall activities and educational items. Shown here on this slide, many of you have seen and have completed the boxes where it lists the competencies of competence, performance, and patient outcome. We would like to bring to your attention that we collect this data and information about changes that result from educational interventions and including changes it expects learners to make. So those changes that learners usually make and or impact has an impact on patients. So keep that in mind when you're completing those three key areas on your application. We are using this data and information because as we are the accrediting provider, and it helps us to look across all of its activities, and it analyzes the impacts in terms of those changes. So again, the competence can be thought of as strategy, as if something to put into knowledge, into action, as well as the learner will do into practice, if they're given the opportunity. So the learner needs to be able to put into practice the knowledge they have gained from attending your program. And now I'm going to turn it over to Tony to continue. Thank you, everyone.
Thank you, Marilyn. Good afternoon, everyone. Now we'll talk about those attendance sheets. So now on the CPDA platform, there is a new form and there is less information to collect. And as you see here on this image, credit claiming for live can remain open 30 or 60 days. It's totally up to you. If you choose to do 30 days, on the 31st day, we asked that the attendance sheet be uploaded. And then on the 60th, if you choose to do 60 days, on the 61st day, we asked that your attendance sheet be uploaded at the close of the event. Now, for enduring activities, that credit claiming closes when that event closes. Now, there's something new that we'd like to add. We'd like to collect the MD and the non-MD information, the total number of learners, when you submit your attendance sheet. And what happens is, if you do that with the submission of the attendance sheet, we won't be bugging you about PARS data information or you entering the PARS data. You won't get a reminder regarding that later on. But you can place the MD learner and the non-MD learner, as stated in this image. It would be helpful if you put it right at the top so we can see it. Please note that the attendance sheet, you will need to provide all this information right at the end of the claiming. The attendance sheet is for everyone who has registered, those who have claimed credit and those who have not. But if they registered for your activity, we like to have them on the attendance sheet. Now there's the final report in the PARS data. After you submit your, as shown here, this information that we're asking now to be shared on the attendance sheet. Also, if you have any financials at the same time of submission of the attendance sheet, you can give us that as well. And we'd be happy to help you if you have any questions to upload that information. Then we're down to the timeline and data reminders, right? And there's a few things to just kind of point out. In the application processing timeline, when you request your CME activity, we ask that you would please take note and to be sure to upload your meeting materials in a timely manner so that we can get the credits that you need and deserve. And there's things that, just the request of your CME activity, the approval we have to take, it's time that we take to process your information and getting back to you. And if you have any questions, again, we'd be more than happy to answer any of your questions at the end of this presentation. Here's the reporting information data. Now, the session evaluation information is due when the final attendance sheet is submitted. Your post-activity data is 90 days after the close of the activity. And again, if you have any questions regarding that, more than happy to help you. Now it's time to talk about the the auto transfer. The auto data that's going to be transferred to ABS via ACCME, that's automatic. We now have the opportunity for our members and non-members to have their CME activities from the ACS automatically sent over to the ABS via ACCME. Now, we're sharing this information with you as there is new language that needs to be communicated to your attendees and your participants. Be sure to use the language that is provided to you with the program materials and the communication along with our website. Thank you. Now, back to you, Marilyn.
Thank you, Tony. Some of the reminders and updates to make you aware of, everyone, is, as stated previously, please be sure that you're using the most recent templates to complete your CPDA application. This makes sure that it saves time and makes sure that we can get to you as quickly as we can with the information that you're going to need. Another factor is receipt of your certificate does not indicate that your activity is fully approved. So again, please make sure you submit all of the required documents in a timely manner, and please be prepared to provide screenshots showing that your system successfully allows the attendee to claim credit. And additionally, use the CPA awarded CME and certificate of completion templates as provided to you. And again, if there's more information you'd like on this, please do not hesitate to visit our website at the CME Accreditation FAC page for more details. Again, our goal is to make sure that your learners are able to show proof that you have given them the ability to claim credit. One of the things I will add on this slide is that we are in the process of, so many of you have shared with us that it's cumbersome to enroll us as staff to test your credit claiming site. So we want to make it easier for you. So when you are testing your credit claiming with your vendor, just please feel free to take a screenshot to show us that the credit claiming worked, it was successful, and all you would have to do is upload that to your application, and that would satisfy us as far as approval, letting us know that the credit claiming site does work and it has been tested. And on that note, I am going to return the session back over to Jada to continue. Thank you, everyone.
Thank you, Marilyn. Okay, we do have one question in the chat that we would like to address. Let me get to that one first. And
okay, it says, how do I know if the attendee claimed credit or not? So I'd like to answer that. So when we send you, many of the leaders on this call, they do a survey. And in the survey, one of the questions is, would you like to claim credit? And if they would say yes or no, in some of the cases, the CME or CE certificate is sent to the individual. So that's how that it's known. It's also collected on the attendance sheet that is sent to us. That's how we are able to find out most times if the person wanted to claim credit on that particular course. Does that answer your question, Scott? Go ahead, Sherry. I'm sorry.
I'm so sorry, I didn't mean to interrupt. I'll just jump in and give some additional information. So Scott, when you go through your activity, there's going to be a process. Everyone, in order to claim credit for a CME activity, you need to complete the session evaluation. That's a template that we provide you at the time of completing your application. When that person completes the session evaluation, they have now, if they're an MD, they have now qualified to claim their CME credit. When you are completing the attendance list for your activity, you will download all of your session evaluation data, right? Because you're going to send that to us as part of your final reporting. But you're going to download your session evaluation data, and anyone who has completed that survey qualifies for CME credit. So on your attendance list, you will indicate the total number of CME credits that person claimed. Now, when you're setting up your session evaluation system, whether it's on your own website, if it's a paper evaluation, if you're using a third-party vendor, there should be a space that says, I would like to claim total number of credit hours. And then there should be a box that permits that person to list that total number of credit hours. You'll have more information about specifically the language you want to use inside the program requirement document materials that we provide you when we're processing your application and we are approving you for that CME credit.
Thank you, Sherry.
Yeah, no problem, Scott. Feel free to reach out anytime you want. You can email any one of us. When you, at the end of this session, you will get a download of these slides. Our contact information is there, and feel free to reach out to us directly. Let's see. We are getting reminders about documents that are due for applications. Yeah, we actually will go over that are we at the end already?
Yeah, we are.
That was fast. Sorry, Emily. I promise I was paying attention. So there has been recently a glitch within our platform that we are working on with our IT department. We have escalated it. You will occasionally receive an alert, an email notification asking for materials that have been submitted. We apologize for that. One of the solutions that we have come up with moving forward is that when we see content submitted, we'll send you feedback directly on your application. Says, great, we received it today. Have a good day. We do apologize for the alerts. We will be mindful to make sure that those alert dates are shifted so that you are not receiving notifications for things you've already submitted. The good news is we are working on a beautiful new platform that is going to be user-friendly, and it's going to be hopefully nice and attractive, and you all will love it and will just love being inside, being able to do all the things you need to do. So have some, give us some time. We're getting it there for you. If you're not receiving feedback on documents just yet, those that you've submitted, we actually learned about this today, and we're activating it tomorrow. So you absolutely will hear from us, I promise. There was another question that popped in here. Our group has emailed contact email address that is on the application portal, but we have not received a response. Oh,
Okay.
okay. Has a contact email is on the other.
You can send that to us direct. Well, send it to mrender@facs.org, and we'd be happy to look into it for you.
Yeah.
Well, I think that's sorry, this is Emily. I'm the one that's been asking the questions. So when you're in the application portal, there's an email address that's like, I can pull it up, but it's the only email address that we can find in the portal to actually contact ACS. And so we have no point of contact with any one individual. It's the general email box that we've not had any kind of, like, we've had sporadic responses. Like, I know that I've emailed a couple of times and not received a response. I know my colleague, who is also on this call, has sent an email a couple of times and like will sporadically get a response. So I'm just trying to understand how often we should follow up if we don't hear a response. Is there a dedicated person per application that we can reach out to if we have questions that can't be answered in the toolkit, like they're specific to our application, anything like that?
Absolutely. So when you receive a copy of these slides today, it has everybody's contact information on this call. So that's the first thing. So you absolutely will have direct emails to reach out to anyone you'd like. You should be receiving, every time you send something to the CPDA inbox, you absolutely should be receiving a response in an extremely timely manner. We'll take a look and see what's happening and how that happened. We'll find out. So stay tuned, but absolutely feel free to email anyone on that list. Can you roll up to the top, please? Jada, I think with the slides so you can see everyone's email addresses.
Sure.
But we absolutely want you to be able to reach us. You don't have to go to a general inbox each time, just so you know.
Thank you.
Yeah, no problem. We want you to be able to do that. And as far as like the turnaround time when you're submitting materials, that'll on our timeline that's on the website, we talk about when you send in that initial application, give us about 3 days to review and be able to flip back to you so that you're able to access that full that full application and complete the forms. So you should get that within 72 hours or 3 business days. Everything else should be in a timely manner. What we do is as those application materials are coming in, we're processing them on a daily basis. So because we have many that come in as we're doing our reviews of materials, we are getting those activities. They're coming up most like the soonest, and then we work our way down. But usually we should be able to get back to you within 3 days or 4 days when you're submitting materials to us. It shouldn't take longer than that, just so you know. So these are the contact here, again, y'all will have a copy of this and you can directly go through and reach whomever you choose. Let's say you sent it to Jada, but Jada wasn't actually holding your application. She will make sure it gets to the right person. You don't have to worry about it. She'll copy you on that email so you know who that correct person is and that we've addressed what you've sent over. So do feel free to keep
And
these.
And Emily, I'd like to add, this is Marilyn. It looks like I am your contact for one of yours. So if you have any questions, I'd be happy to reach out to you after today's call.
All right. Thank you so much.
Mm-hmm.
No problem. If I may, can we go to the slide that talks a little bit about disclosures? I want to give a
Sure.
little bit of more information about disclosures. So there are 3 types of templates that are currently sitting on our application. So when you go and you look at your application, you're going to see the disclosure form, right? So that's something that Marilyn talked about, where this is what you're giving anyone and everyone who is in control of the content. It is an author, it is a planning committee member, it is faculty, it is a moderator, a speaker, it is you if you're working with the staff and with the committees. Even you would submit a disclosure form. It's anyone who has a part in the content. Okay, we call it controlling the content, even though there may be a committee or a subset that are yaying and naying what's in place. It's anybody who has looked at, touched, or is participating in this CME activity. Those disclosure forms need to be completed. Checked boxes need to be checked off, and they need to be signed. We do not collect those disclosure forms any longer. We ask that you keep those on file for 6 years. So should we have to go back and check something through our accreditation process, that we're able to refer to that disclosure if need be. Okay, so that's the first thing. You do not have to send those forms. What we actually want from you is the disclosure summary list, which is also what Marilyn brought up. On the disclosure summary list, 2 things to keep in mind. To the right side of that disclosure list, there are mitigations for conflict. So if you have someone who has a conflict, there's actually, if you click inside the cell, there's a drop-down box that gives you specific mitigations sources for conflict, and you just have to select one and put it in place. And by you, I mean the chair. So the only people who should be mitigating conflict and reviewing disclosure forms is your chair. Your chair cannot, or your program director, whoever's in charge, let me clarify that. Your chair or program director cannot mitigate or approve a disclosure form for themselves. The co-chair needs to do it. If there's not a co-chair, just take the second in command as our point. So you never can mitigate for yourself. Staff should not be mitigating. It should be the leader or the chair of the planning committee. Okay. And then the only other thing I want to add, I want to talk just a little bit more about the disclosure lists. Disclosure lists are only needed if you went to print. You have a program book, right? You're going to be on site. You went to print and you didn't have your disclosure summary ready just yet, right? So what you did was you printed your book. Now you're sitting at that registration desk. The disclosure list is literally like a piece of paper. I'm trying to hold it up here. A piece of paper that goes inside your program book so that the learners, when they register, have a list of those disclosures. You only need to do this. The only time you need to do this is if you do not have the disclosures of all of the participants inside the program book, on your registration website, on your website product where you're advertising the program. That's the only time we want to see a list. We do not need a disclosure list. If you've put it inside your book, if you have a QR code that takes you to a list, if you have a link that takes you to a PDF of a list, that's fine. That meets the requirement. We do not need a disclosure list mapped out for you if you are not physically taking a piece of paper and handing it out as people are coming into your conference. So I just wanted to clarify that for you all. There was one more thought I had to that. No, I think it was just making sure I said QR codes. Does that make sense? Anyone have any questions about that? No?
I would just like to add to the group that although we don't collect the individual disclosures, it is required that they are on file for 6 years, just for our reaccreditation process. So while you don't have to individually upload them all, they're required, those documents and that data is required to be saved for 6 years.
Yeah, they sure are. And the with the program requirement document, I know Tony mentioned earlier, we're now starting this auto send process. Rita, I'll answer you 1 quick second. We're starting this auto send process. So your registrants, if they have a profile at ACS and you provide us with their ACS ID on your attendance lists, we can go ahead and add their CME credits to a transcript. And if they log into the site and they opt in and participate, their credits will automatically transfer to the American Board of Surgery. We're working on the other boards. We're not there yet, but we do have ABS done. They'll be able to opt in and have their credits automatically sent so they don't have to do anything and you don't have to report anything, and it's just beautiful. So that information is inside your program requirement documents. So you all are going to start seeing a different set of language inside the document, which is why we always say, please go back to the website, download the latest templates, because inside there is the new language for the opt-in. But what is also inside there, and this, I'm tying it back to the disclosure list. What is also inside there is the new table that the ACCME is requiring. So back in the day, we used to be able to say, Dr. Jada Higgs, nothing to disclose. ACCME now wants specific language that states Dr. Jada Higgs has no relevant financial conflicts to this activity, or I forget exactly how the language is. So you're going to see a new table that is inside that Word document. One of the suggestions we had from an earlier webinar today was to take that disclosure list template and turn it into an Excel document. So you will see that change coming soon. So you will have both your disclosure summary, will have one format in Excel, and then your disclosure list template will match that Excel. So it's real easy for you guys to transfer over if you have to use that list. So just so you know. Rita was asking, the disclosure list, can it be published on the meeting website? Absolutely. That's the easiest way to go, folks. The easiest way to go. Pop it. You can pop it on your product page. The goal is to make certain that the learner, before they walk into the room, they know who the disclosures are. Now, that being said, not only can you put it on your website, but you also, when that speaker begins their presentation, they can pop up a slide that says, here's my relevant or non-relevant disclosure of conflict, right? Or they can say it verbally, as long as that message is getting out there. That's all I wanted to say about disclosure lists.
Anything else that we would like to, while we're all here, discuss or dig into really quick? It may or may not be a topic that we covered in the slides. Any question that you may have? So I guess with that, we will give you some time back into your afternoon. We do thank you for your time, for joining us, for your engagement. You will receive a copy of today's presentation and the video recording today. Well, within the next, let's say 24 hours, you will certainly receive that. Again, our contact email is cpda@facs.org. Please reach out to us with any questions or concerns. And again, we will send you a survey. So if you want to add any suggestions or just provide us with any feedback, we value and appreciate your participation in that survey. So with that, I guess we will end today's webinar. If no other burning questions have arisen, thank you. Thank you for joining us.